Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder here. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. And now we're just getting our first look inside the joint. We're going to take our shaver. Hold the camera just for a second right here. And you can see we've got some labral fraying here right at the base of the biceps. We will stop there and look at that. It's really not that bad. A little bit of wear and tear changes. It's what we call a degenerative tear. But the tendon itself looks pretty good. Okay. We'll look up at it. So here's the biceps tendon as it exits the joint. It looks pretty good. Now behind this is going to be the rotator cuff tear. So as you look up here, this is torn rotator cuff. You can see there it's retracted just about to the level of the glenoid. So we'll keep working here. This is all going to be easier to understand when we change positions with your shoulder. But right now the shaver is working where the rotator cuff tear should be attached. Okay, and we'll look, reach underneath and hold the shaver just for a second. As we look around the rest of the joint, lift up on the shoulder just straight up. You can see here's a little bit of a wrinkle in the cartilage that we can usually take care of pretty quickly with our shaver. Can you drop her systolic just a little bit? I think she bumped up. Okay, no problem. And then as we look around the back of the shoulder, a little bit of redness in the capsule, but otherwise no significant structural problems. Okay, so we'll finish up inside the joint. We're going to get to work in the subacromial space next. Okay, so we're in the subacromial space. Just to give you a little sneak preview, that's the tear in the rotator cuff. Pretty good sized tear. We've got it exposed all the way up to the biceps tendon there. So this anterior's on the right, posterior's on the left. Just keep that picture in mind. We'll come back to that. First, we're going to take off a little bit of bone just to make sure that we have nothing that's going to pinch the rotator cuff. So right now, I'm way over here by the AC joint. That's actually the edge of your clavicle right there. So that's the edge of your clavicle. We're going to sweep underneath it, make sure nothing that could pinch on the cuff here. And now we're going to rotate, hold this right here. We're going to rotate the camera and look down the front of the shoulder and make sure there's no spur hanging down here. So we'll take off this little anterior lip of the acromion. But fortunately, you don't have a very large acromial spur here. So we'll come back here, and now we'll plan this repair. We'll show you some more in just a minute. Shaver back. Okay, so we're planning the repair. This needle coming in helps us plan our suture anchor placement. This is the posterior aspect of the tear. This is the anterior aspect. Again, that's the long head of the biceps tendon as it enters the joint. The joint is actually down through this hole down in there. So that's what we're going to be covering up. So it looks like if we do one anchor, I'm not sure if that's going to be enough. We'll start with one anchor right about here. You might even have to internally rotate the shoulder a little bit. You can see that, hold the camera right there. We can see that this posterior part of the cuff doesn't really start to reattach until we get to right about here. So I think I'm going to place my first anchor right about there. We'll take a scalpel. And then we'll take a guide. And then we'll take our anchor first. And we want to come back about 5 or 6 millimeters from the articular margin, which means placing it right about here. That looks like a pretty good spot there. And then once we bury that, we can unload the inserter. Very easily. And then we can seat the anchor by pulling back on it. So now that's seated. Sorry, we have a little bit of a cloudy picture. We'll clear that up in a minute. Maybe we'll put a little bit of epi in the bags, guys, in one bag. 3 cc's. Crochet hook is the next thing we need. And then we need a grasp vertebra. So as we look at these sutures, we're going to start with the posterior most suture. So I'm going to start with this black and white striped one. I'm going to pull that out, this cannula here. We'll put a grasper in there. Regular is fine. And then we'll take a straight crescent suture hook. Okay, so here's our grasper coming in. We're going to reach in. Here's the important thing, in my opinion, one of the important things, it's a lot of important things actually, is we want to make sure we get the deep layer of this tear. See that? If you don't get that, you're not going to have the full thickness of the tendon repaired. So we're going to hold this here. The other thing, 2 hands on it, because that'll keep you stable, right there. The other thing is we want to take our hook and see that it points right where we want it to come through like that. And there we are coming all the way underneath. So I like that bite. We're going to confirm it just by looking back here. That looks great. It's a very posterior suture, which is exactly what I wanted. Hold that right there. And now we'll go ahead and grab the relay. That black wire that you see is called the super shuttle. It used to be called the shuttle relay. Do you know how to load those? Okay, go ahead and do that. It used to be called the shuttle relay. And so we'll go ahead and load that. We'll put about 1 inch of this into the hole right there. Go ahead, you do it. Just about 1 inch. Through right here is a hole right there. And then the key here is just hold it like that right there, and then just follow it up to the cannula as I pull. And then when, don't let go, now you let go. Okay, and so now you can see how that's going to bring that black and white suture with it. Grasper. And as you watch here, see how that's going to bring it all the way underneath. There it is coming out this posterior cannula. I'll take the crochet hook one more time. And I think just to give me a good anchor point, I'm going to tie this suture right now. So I'll need a knot pusher and a mosquito. Here's the partner suture. This is why there's 3 different colors. And so now you can see we've got a loop, and now the problem is just one of tying a knot, just like tying your tennis shoes. So we'll go ahead and tie this knot and show you what it looks like when we're done. Okay, so here's our first knot. There it is. And you can see how that's sutured down this posterior aspect of the tear. See it right there? And I like that. That's a good start. That just really gets us to the starting line, though. We've got about 4 or 5 more sutures to pass, I think. We will get the next ones in line here. I'm going to take this solid blue one out, just like that. Okay. And now we're going to do the same thing. We're going to use a slightly different angled hook this time. This is called a turn to the right. Oh. Okay, so see here, this hook is a little bit more curved. And so I always rehearse the stitch. So we want to end up here, which means you want to go into the tendon right about here, maybe a couple millimeters lateral to the muscle tendon junction. Hold this right here. I'm going to use my grasper just to check on the flexibility that we have. There we are, coming all the way underneath. We always confirm that. And then just like before, we're going to feed that blue suture into the black relay and bring it back. Okay, so there goes the blue suture. We'll take the crochet hook and get the partner suture. Now I usually do not tie this one because it starts to close down the tear and we can't really see where to place the next suture. So we'll leave that one there for the moment. What I have to decide is how we're going to do the next stitch. We're all the way up to the biceps tendon, so I think we can pull that down nicely, which means I'm going to take out these sutures. And we'll take this suture now out posterior just like that. And then from the front of your shoulder, we're going to take a turn to the left suture hook. Take a grasper in the back. So there's our hook coming in. You can see what we're trying to do here, something like that. Hold the camera right there. We don't want to capture the biceps tendon today. Sometimes we do. Okay, there we are coming underneath. We'll go ahead and feed that through. Okay, I got it. Okay, so what we're going to do now is start to tie these last 2 sutures. Okay. Hold the camera there. So our post, what we call our post, is always on the rotator cuff side of the tear, not on the bone side. So that's our post right there. These are sliding knots that we tie. So I had a patient a long time ago that said, oh, it's just like tying your shoes through a straw, and that's still probably the best description I've heard. So helps put an image to it. We'll go ahead and slide that down now. There it is right there. And then as we pull tight, you can see how that really snugs up the rotator cuff to the bone right there. And we just tie some half hitches behind it just to secure the knot. And then we just cut those suture tails. And then we've got one more. I just need to cut that. I'm sorry, I didn't cut. Grasper and a pair of arthroscopic. Okay, so we've tied the second and third sutures. Let me give you the overall look. That's the third one, that blue and white one. You can see there's no more hole. And what I like is as I rotate your shoulder, everything looks pretty solidly attached to the bone now. The first one's right there, that blue and white one. Then we had a solid blue one, which is kind of buried in there, but it's there. And then we had a blue and white one right there. So they're spread out kind of like a V. And now the big trick now is to take the punch, and I'm going to make a little hole in the bone, a couple holes maybe. It depends on the size of the punch. And this is going to open up the bone marrow space. Go ahead and tap me real gentle. Keep going. Okay, one more. And that's going to let out some of the bone marrow elements to participate in the healing response. So with this size tear, I think we can safely get 2 in. Just made one. There's another one. And you can see as I turn down the pressure, you'll see some of the marrow elements start to even come out of that. They look like little fat dropules or droplets rather. And there you can see them start to come out of the holes that we made. Okay, so we're going to finish up here. Good luck to you now. Bye-bye.